All right, here are some of the questions that Tennessee is going to answer in the process of designing our own insurance exchange. First question is, do we want to do it ourselves, or do we want the feds to do it? Right now, everybody's leaning towards the state doing it, but like I said, the administration has not made a final decision about it. If the state chooses to run it, who's going to run it? It could be under the 10-year bureau, it could be a government agency, it could be a totally separate nonprofit, it could be a quasi-government agency, it could be a nonprofit with an elected board, it could be a nonprofit that the governor handpicks everybody on the board. There are all these different questions that are going on right now. And that determines what the exchange actually looks like. You think about the governing body is making decisions about it, and I shared this in one of the earlier forums. What we're looking at, so for example, there are a handful of states that tried to pass legislation to set up their exchanges this year. One of them that's probably going to be a very similar conversation that we'll have here was in North Carolina. One large insurer owns about 90% of their market. That insurer wrote a bill that put them on the board permanently. And they said, and basically what that means, it was Blue Cross Blue Shield, they own 90% of the market. But they said, we're going to be a permanent voting member. And the consumer advocates and the hospitals and the doctors freaked out. And they said, how are you going to regulate your own plans in exchange as well as all of your competitors? That's not fair. And so that is one of the options. That's something that we have to think about, and that's something that I think about a lot. A lot of the decisions we make ultimately have an impact as to what sort of choices people have when they shop through the exchange. There are a lot of other things. So that's conflict of interest, and that's been a pretty big issue in a lot of states because the people who know the most about how insurance works are often people who work for insurance companies. And so it's sort of trying to figure out that balance between getting the information, but also creating that competitive marketplace where you can bring in new competitors. All right. By next year, Tennessee's legislature, or state legislature, which actually has adjourned, they were supposed to end their session today. In Tennessee, every state has a state legislature. It's our own house, it's our own Congress, essentially. Well, the state legislature in Tennessee begins in January and usually adjourns about May, June. It varies from year to year. They're trying to finish this week. It may roll over into next week, but they're about to adjourn. They didn't pass any legislation about the exchange. So there's going to be some planning on the state level, but the state has to get legislation passed to set up our own exchange. Well, we're talking with legislators to help them understand they have to pass legislation next year. If we want to run our own exchange, we have to pass legislation next year, or we have missed the window of time. Remember, next legislative session is the last window that we have to do that before the 2013 deadline, where the state or the Fed will determine who runs it. All right. So this is sort of a big, tricky concept, especially if you're not familiar with insurance terms and how insurance is sold. What sort of questions do you have, or what sort of concerns? If you are somebody who is looking to shop through the exchange for your health insurance, what would you be worried about, or confused about, or frustrated about?
I have a real basic question. I'd like to change the metals.
Change to a different name?
Well,